Good afternoon, everybody, and welcome to the webinar. Today, we are in our Conversation With webinar series, and we're very excited to have a conversation with a cardiac dietitian. We're being joined today by Megan Horsley from Cincinnati Children's Hospital, and we are very excited to get into the details of this. We know feeding is a big frustration in the CHD world. Before we begin, I just need to give you a couple of updates. All attendees are in listen-only mode. So if you cannot hear, check the audio button on your personal computer to assure the sound is on. Please type your questions into the Q&A box at any time during the presentation. Your questions will be read and answered after the conversation, but just note that we will not be able to answer questions about your child specifically or about you as a patient, because Megan is not your treating physician. And then also a PDF version of the slides, as well as a recording of this presentation, will be available on the Mended Little Hearts website following the event. I am Andrea Baer, the Executive Director here at Mended Hearts, and Jody Smith will be the moderator for this session. Mended Hearts Inc.'s mission is to inspire hope and improve the quality of life of heart patients and their families through ongoing peer-to-peer support, education, and advocacy. The Mended Little Hearts program serves the littlest heart patients of all, those who have congenital heart defects and their families. And as I said earlier, we are joined by Megan Horsley. She is a clinical dietitian at Cincinnati Children's Hospital Medical Center. Megan has over 13 years of experience in pediatrics with focus in cardiology and currently practices in the critical cardiac intensive care unit. Her most recent work has involved quality improvement in weaning heart patients off of their feeding tube and improving maternal nutrition of moms with a fetal diagnosis of congenital heart defect. She is a certified nutrition support clinician. In addition, maintains her certification as a specialist in pediatric nutrition. She received her undergraduate degree from the University of Cincinnati in 2006 and completed her dietetic internship, with the University of Northern Colorado in 2007. She is involved in many projects, research, and quality improvement work, including the National Pediatric Cardiology Quality Improvement Collaborative. She has served as a board member of the now named Congenital Heart Alliance of Cincinnati since 2017. She has over 13 years of professional practice in pediatric nutrition and over 16 years of personal experience as a heart mom herself. She plans on continuing to concentrate her efforts on improving the nutritional care experience and outcomes for all children affected by heart disease. Megan, thank you so much for joining us. I am going to turn it over to you and Jody.
So Megan, thank you so much for being here today. We were really excited about this topic. As you know, we've been focusing a lot on feeding issues in babies with CHD because so many parents have found themselves incredibly stressed out. And we're excited that you're going to address some of those issues and all across the lifespan of the child because it is a constant source of I would say frustration and a need for information for parents. So we are thrilled to have you here today.
Thank you so much to Jody and Andrea for both inviting me, as well as Mended Little Hearts, and inviting me to speak today. I'm happy to be here.
Well, thank you. And I'm going to start where often is a good time to start. Could you give us a little bit of background about yourself?
Absolutely. So I am born and raised Cincinnatian. I actually come from a really big family. I guess not really big, but really big to me. I'm one of five. I have 3 older brothers and a twin sister. And I have grown up with a great, 2 great parents that have been very successful in their career, that have inspired me to share that same work ethic. So I feel that has been a critical point for me as far as having that role model and to continue on in my own career and develop and thrive. I was big into sports growing up and started to really take an interest into nutrition, and wanted to be a doctor or a exercise physiologist or something in the healthcare field, as I was growing up. And I watched my mom go through cancer and, kind of learned a little bit more about the medical field. And so I knew that I wanted to do something in the healthcare field. But essentially what kind of led me to dietetics was that at the time my mom worked at a technical college, and of course, money talks. So I was able to start and get my associate's degree in dietetics and start working actually in the field while I finished my undergrad. So I'm a UC grad and went through my internship via the Northern Colorado. It was a distance internship. So I basically kind of created my own internship experiences, which has then led me to work at Cincinnati Children's. So a little bit more about my family to date. This is my family. I have my husband, Matt, and my 3 children. We all have M names. My daughter is my heart hero, the redhead, and she just had her junior prom this past weekend. Her name is Maggie, and then I have a 9-year-old who's Miles and a 6-year-old Maverick. The other 2 members of my family can't also go unnoticed, and that is my cat there. Her name is Snickers. And then new to our family during COVID is Enzo, my mini golden doodle. So that is a little bit about me and my family. And I kind of spoke a little bit to this, but I'm very into running and adventurous things. So I participate in a lot of relay races or just opportunities that come about where I'm able to travel and also do exercise at the same time. And I like to run marathons. And so my friends and I, there is at the bottom there, we have our Flying Pig attire on. We created our own COVID marathon during COVID and ran that on Halloween. So I definitely have a love for outdoors. I love being creative with nutrition, which is the tortilla wrap that I actually created for some of our education material. And I just like to be goofy at work sometimes too. I have a wall of patients, and I'm very proud of what I've done to date and who I am and what I speak for. And so I love learning, and I love being challenged, and I love meeting new people. So
that's excellent. How you told us a little bit about how you got into being a pediatric cardiac dietitian, but how can you tell us a little bit more about how you ended up at Cincinnati Children's and how you ended up in this specialty?
Absolutely. So as I was working through my undergraduate, my daughter came along, and I had like the perfect pregnancy. There was nothing that was thought of that was going to be wrong. I was tracking actually my protein intake and my making sure I had good nutrition during pregnancy and weight gain. Because obviously I was into nutrition and learning about nutrition. So I wanted to have that optimal and best pregnancy that I could. Well, certainly lots, curveball kind of came after Maggie was born. About 2 hours, she was rushed to the Children's Hospital, and our journey with congenital heart disease was started. So my daughter is the reason why I'm in cardiac, actually. At the time, I didn't know where I kind of wanted to work, and I was working actually in the nursing homes. And certainly having some frustration with the lack of reward, if you will, with my nutrition interventions. Nobody that's already lived a full life wants to change their diet, in a sense. So at the time I was still in school throughout my daughter's experience, but she's really the reason why I wanted to become a pediatric cardiac dietitian. So she went through surgery about 2 hours after she was born. She went through a lot of scary situations, like I'm sure many of us have experienced, ECMO, oscillator. So I wanted to improve the experience for the patients and families that came behind me. And I wanted to give back. I mean, that was the real reason. Is I was so thankful that they kept my child alive. And that led me to want to do better and to give back for everyone that came behind me. You know, we had some negative experiences and we had positive experiences. And we had a lot of feeding challenges and almost every feeding complication that our children go through as cardiac kids, I experienced, and I was very naive at the time experiencing them, but what I learned and experienced had made me a better, not just a better mom, but also a better dietitian. And so she's the reason why I became a cardiac dietitian. So.
Well, there is no better reason than that for sure. And she is absolutely beautiful. Thank you for sharing her with us and your journey as well. So your daughter is about the same age as my son. And I remember having many, many feeding issues as well. And I have been really encouraged by how much has changed since our children were babies, and it's very encouraging and exciting, and yet I think we have a lot further to go too. Can you tell us a little bit about what you have seen as the major changes in nutrition and feeding for babies with CHD?
Yeah, you know, it's actually, I'm so excited to like share what I've seen change because I know it's for the better. Almost every baby born with a heart defect gets opportunity to feed or be fed before surgery. And that I feel like is a huge change from my perspective, because babies, we didn't feed babies before they were, you know, before surgery, or we fed very few lesions that were before surgery. So I feel like the fact that it's almost like if you're an outlier if you're not feeding at least a little bit before surgery, and the culture has definitely changed around feeding, because we know feeding before surgery, you're learning nutritive skills. It's going to have more positive outcomes after surgery. We've definitely shown that in the literature, that you know, preoperative nutrition matters, and not just to survival and getting out of the hospital sooner, but also to improving like oral skills sets and being more of a successful feeder long-term. That's one big thing that I've seen change, as well as like even just the prenatal diagnosis. You know, I think it's about 80% of like the critical cardiac defects are now prenatally diagnosed. And so I feel, at least at our hospital, a majority of those that are coming in for surgery within their first year of life have already had, like, these parents knew about them, about the defect. And so this is one reason why we got a grant to do a nutrition project where we are counseling the moms on their nutrition shortly after they've been diagnosed with their fetal cardiac diagnosis, because we believe there are some pieces to the maternal diet that can impact the outcomes after birth. And so, you know, specifically like some of the fat soluble vitamins that we're paying close attention to, proteins. You know, protein intake is huge in the mom. You know, we know that bigger babies do well when they're born at, you know, more closer to term and good size. So that's another big change that I have also seen. And just how, I think just like the complexity of lesions have changed too. Like, so many babies are born with multiple lesions, it's not a straight shot or a straight fix, if you will. And so I think that's been more challenging. There's like a whole list of changes that I've seen. Peritoneal dialysis is another thing that we use that has been a big change, as a means to help remove fluid after surgery so that we can optimize their nutrition and give more nutritional fluids right after surgery to get that, try to mitigate that metabolic response to surgery. And then in addition, the ventricular assist device and the uses of that in our patient population is a huge change, I think, in a positive manner. We're saving lives and these kiddos are living so much longer. And it really hasn't been that long. So I think those are like the main ones that I can think of.
Well, those are definitely very exciting. The prenatal nutrition that you can really do things to impact that is fascinating to me. I wasn't unaware of that, and I could probably ask you a zillion questions just about those answers alone. But I will ask you the other questions as well. So, what do you feel like, from your perspective, is the most misunderstood thing about being a cardiac dietitian, or about feeding, or about any of the field?
That we're not just focused on diets, I guess, if you will. We do a lot of different things as dietitians in the cardiac world. We help write like IV fluids. We really pay attention to electrolyte changes, and we write IV nutrition. A lot of us, especially in the critical care area, take responsibility of really the nutritional care. We help create the very first feeds these children have. So we certainly aren't just recommending, low fat, low sodium kind of diet for everyone. It's a lot more individualized, and I like to say sometimes feeding and nutrition is like a art, not necessarily always a science. Obviously, we want to have the science background and understanding of the literature that's out there. But each kiddo is different, and we have to create these individualized prescriptions that meet their needs for their nutrition and their growth. So.
Well, I think that's so important. Recently I was talking to someone about, the human breast milk, and they were talking about how, we think of it as food, but it's all part of something we're giving our baby, and that it matters. It matters what we give our babies. And we were talking about the Fortifiers. And so it's really interesting to think about it as more broadly and look at the whole picture. And so that is definitely, I would say, yes, that is something that's misunderstood. And I indeed misunderstood it as well.
Yeah. And it's funny, sometimes like even other physicians are like, well, what is, just tell dietary that, they need to change the trays. I'm like, well, actually, we have nothing to do with the kitchen. And it's actually a little separate. I'm not back there cooking the pancakes today. But yeah, like it's very individualized, and really try to be thoughtful at least I am in the decisions that I make with the families about the nutrition plan, because I feel like that's a responsibility of mine, is to set this child up for the most success as we possibly can, and make sure that, the parents are involved in that decision. I always think about this, like when you didn't know you found out you were pregnant, you start to think about, how you're going to feed your baby before you even know that your baby has an issue. And my goal is to support that plan the best possible way, and understand what the goals are of the parents and how they anticipated and desire to feed, and then advocate for that. So I definitely feel like that's sometimes a misunderstanding is it's not low fat for everyone. It's not, cardiac diets. We don't even have that title in pediatrics. And so, but yeah.
Well, that is funny that people think you're back in the kitchens. And but when you were talking about the parents' role and advocating for the parents, how would you say, can you give us more information on how parents can play a more active role in nutrition in terms of their child when they're in the hospital with their baby?
Yeah, so I think it's important to try to incorporate the parents, big or small, into the care every day of their child, because it's scary. And I had a scenario actually today where, their child, my patient's child, is going to get the breathing tube out today. And I mentioned, oh, so you're going to hold today. And the dad's like, oh, no, I'm not holding, like he's very scared. And just try to educate and encourage, it's important to hold for their neurodevelopment and safe, obviously in safe situations, and everyone is aware, but making sure that, and encouraging and empowering the parents to feel that they can be a part of the care of their child every day, even if it is just grabbing the linens or putting, changing a diaper or whatnot. Other pieces, really trying to understand their feeding goals. That's usually one of the first questions I ask when I meet parents is, what was your plan for feeding? What have you thought about? What have you heard? What do you want to talk about? Because my goal is to advocate for that. And of course, incorporate what I know would be as best for that situation, but really trying to understand what the parents' goals were. Feeding is the one thing that we can control in this situation. And so I tell parents that all the time, I want you to be a part of this decision. And, here is the education about what to feed or how much to feed. But that's the coolest part for me is I get to help parents learn how to feed, or learn how to feed their cardiac baby that just went through heart surgery. I don't know about you guys, but I didn't learn how to feed during my prenatal classes. And so it's a whole new process and system. And now you have this fragile baby that, you're scared to touch almost. And so empowering the parents, I think, is huge in helping them educate them about the expectations around feeding and what it may look like, if it's good or bad. And just having those constant conversations about the changes and the experiences around feeding is extremely important.
I remember that it never occurred to me to ask about choices around feeding. It doesn't. I remember we were trying to keep my son alive. We were in for about 2 months after the Norwood surgery. And I remember it didn't even dawn on me that I had any choices around it, that to ask questions around it, and feeling really frustrated and helpless around that issue, because I was also scared half to death of hurting my child. And I remember the first time I attempted breastfeeding him, and it was way after he was intubated 5.5 weeks. And we went through that whole situation and infections and so forth, and it scared me to death. And I didn't feel like I had the information I needed, and I almost quit. But luckily my mom said, no, you can do this, just keep it up. So I'm really glad to hear you say that you're helping parents really understand and educate them, because I don't think before parents were educated at all on this issue. And so this is a really, yeah, right?
Yeah, I felt and that was one of my experiences through my journey, is that I didn't have anyone telling me what it could look like, if it could be different. I challenged them myself, and thankfully I had a support system that helped me be a voice. And I think about feeding, like you mentioned earlier, is a stressor, heart defect or not. I mean, I have feeding stressors with my 6-year-old picky toddler eater. So and you just add the heart on top of that, it is a huge stressor. And we have a lot of parents that give up, whether it's, pumping or with breastfeeding, or just in general, just want to be told what to do next. And so really it's important to support them through those experiences, and really try to just give them as much education about what we know could go wrong, or which way the goals of that week, of that day. A lot of times, we'll make a change during the rounds, and it's important for me to follow up with that change in the afternoon to make sure, did that seem like that went okay? Does it seem like we're going in that direction? So yeah, we want to have parents be part of that feeding plan, because it is the one thing in this situation that we can often control, but it is also one of the very scary things. The other, I think, nice thing is with the prenatal increase in actual diagnosis, fetal diagnosis, there's a lot more discussions, I think, happening around feeding, even with the surgeons. And so I think that raise in awareness has even helped the team as a whole to have more of those discussions, moving forward, as far as how are we feeding and what are our next steps and stuff like that. So.
Well, that's just fantastic. And you're right, because when we asked a lot of questions around feeding when we were developing our feeding guide, and it was amazing how many parents said after survival, the number 2 stressor for them was feeding issues, and they wish they had known more about it, and how much anxiety that caused them. And speaking of that, and you mentioned your 6-year-old, obviously a lot of our members have children that are a little older. They're out of the hospital stage. So can you tell us a little bit about what you would like those parents to know, and what kind of services and support you can offer as a cardiac dietitian to those parents as well?
Yeah, I think, there's certainly all different types of eaters, if you will, and everyone is maybe on a different journey and a different state of their feeding journey with their child. If your child is kind of tube dependent, if you will, things that certainly as they are older and you're working on developing maybe oral intake and oral skills, you can think about really encouraging more of a whole blended food type diet, even via the tube, to help, at least, even if they're not tasting it, they're still getting real food. And it does matter. I've seen kiddos be transitioned from straight liquid diets to blended type diets, where there's whole foods going into, pureed whole foods going into their belly, and then they start eating down the road. So there are options to even encourage good nutrition, healthy nutrition, get them exposure to foods, even if they're not doing it by mouth. If you have a picky kiddo that is eating, repetition is key, and it's like operant conditioning. It's like you're training your dog in a sense, not to call our children our dogs, but the mechanism and the process works. We know kiddos need constant reintroduction to foods and healthy foods or different textures as they're building their motor skills and sensories. So, we know we have 800 taste buds on our tongue. And the more you offer and repeat, even as frustrating as it is that you made all this food, but they're not touching their plate, having them still being exposed to it, ultimately there is some acquired taste. And so, you don't have to do large quantities of exposure, but at least trying to offer it in a different manner, or, blend it into something else, can certainly help build on that variety, build on the textures, and ultimately developing a taste for healthy foods even later in life. So, what you do today does have an effect 2 days, a week later, down the road, even though it's frustrating in the moment, role modeling that and constant exposure it does make an impact, even if it's not immediate. So I don't know did that answer your question?
Yeah, yes. And so it made me think of, I remember when my 2 older kids who aren't heart kids were little, and I got Jessica Seinfeld's book, How to Sneak Vegetables into Food.
I've read that. Yes. I tried that too. And I was frustrated with it because it didn't
Yes.
always work.
Yeah, no, it didn't, because
But,
you can
yeah.
definitely taste cauliflower in anything.
Yes.
So, but it is interesting to try different ways to add food. But along with that, so as the kids are growing, what resources would you say are available to parents? Like, what resources could they access that would be helpful to them? Because I know a lot of us, like, this is great for parents listening, but a lot of us need a lot more information. And of course, always working with your own your child's cardiologist, never always check things with your child's cardiologist. But can you give us ideas about some resources available to families?
Yeah, absolutely. Well, of course, there's some non-cardiac specific resources like the eatright.org, and certainly we could kind of post these links later after the webinar. But this is the Academy of Nutrition and Dietetics, and they have all kinds of different videos and information about introducing foods, picky eaters, just different ways like I'm trying to think of the word, disorder type eating patterns, like how to address some of those things. So that is one good resource that is out there. Ellen Satter Institute, I don't know if you've ever heard of her, but she developed this non-for-profit kind of institute, but she's a dietitian and a psychotherapist, and she created this Satter feeding dynamics model. And a division of responsibility with eating. And this is a really good resource for just, again, general feeding your child. So that would be another option. There's a doctor out there from University of Michigan. It's the feeding doctor. She also has published some information about establishing healthy feeding relationships. Because as you can imagine, a lot of our kids are on, high calorie. We're trying to force these calories in them because they're like running marathons and they need such high calories. And so there can be a lot of negative associations or experiences with around feeding and foods that we want to try to avoid. So in any situation, however young or old your child is, you always want to try to create positive oral experiences and a positive relationship with foods and feeding. And so those are a few that will definitely be helpful to read about some of that and some strategies on how to do that. And then of course, there's certainly the support groups, the things that like Mending Little Hearts, the different educational resources that are out there via the support groups or some of the Facebook groups. Those are other options for families to get some more information. Each hospital should have, at least the nutrition department, should have some educational tools and handouts that are also available specific to cardiac or even other topics around feeding that might kind of reach the goals of the child at that time and the parent of that time. So I would certainly look into those as well with each of your centers' nutrition department.
Well, that's excellent. Mandy's been putting some of those links that and I was writing them down.
Oh, yeah.
She's been putting them in the chat box, and we will add those to our website, also on our feeding page. And so that's excellent and very helpful, especially with the picky eaters and some of the tips that we can access there. Yeah, Mandy said she'll get
yeah, I was saying I can certainly send them as well.
Yeah. So we will definitely have those, and we can send them in the follow-up email as well with the link to the recording. So along with that, and is kind of the questions that, like, certainly they could ask for if there are resources on feeding and nutrition available to them at the hospital. But what other questions would you like to see parents start asking about feeding their child?
Yeah, I think being aware of like the numbers, I guess, in the sense of like how much is their child getting in a day? And having a good sense of calorie goals or protein goals, I think is important, because then you can work with them and really try to, achieve those targets. Because you have to work together. My job is to just kind of guide and educate and prescribe what I think would be best for that child, and to grow that child and to meet those needs, the nutrient needs and vitamin and mineral needs. But you guys are the ones implementing the plan. And so you have to believe in the plan, and you have to feel good about the plan. So I think it's important to, know what the goals are, hands down. What are the goals for their nutrition and their weight gain goals? And then having those specific targets and interventions on how we're going to meet those targets. So, a lot of times after surgery, these babies have really high calorie needs and high metabolic demands. And we know the further out from surgery, these kiddos tend to have a lower, their demand decreases the more stability there is. And so we know we can grow our cardiac kiddos pretty normally, if you will. But we have to be all on the same page as far as how we're going to get there, and have a conversation about what that looks like. So I think that's a big one, is this conversations about just knowing the goals and kind of coming to a compromise, if you will. They don't have to be lofty. I think small attainable goals creates, gets you to where you need to be on the big picture side. So one step at a time. I like to think very simply when I'm working with my patients, like, if we're only getting 80 calorie per kilo per day in, and somebody's saying the target is 120. No, my target this week is 90 calorie per kilo. I keep it very simple. And then once we reach that, then we'll set a new goal. So, forward progress in a lot of scenarios, especially in the critical care setting, is like, for me, I'm doing good. Although, like, I still want them to grow and meet their targets, but I try to think very simply when I'm thinking of interventions to propose to the parents and whatnot. So.
Well, along that same line, I think a lot of times the parents can have a lot of questions about what their child is being fed. Like, they don't understand the different types of formulas, the portogens, the TPN, especially. Like, I remember that scared me to death. Like, I thought my child's not being fed for 5.5 weeks, so what,
Right.
In terms of that, do you feel like there's more out there to help explain that to parents? And do you feel like there are choices that parents can have even around what their child is fed?
Yeah, thank you for bringing it up, because that was another thought I had, is that that I forgot to mention, is that knowing the why we're doing this, or why we're choosing this fortifier or modular instead of that other one that you may have heard about or had someone tell you about. A lot of the improvements in our care and our standard of care around feeding have come from parents' experiences. And so, I think it's important to continue to ask questions and ask the why are you doing this? Or I've read about this, why can't we think of it this route? Or have you thought about this? So we try to be, I think that's also an important piece for the parents to know, is like, ask the questions, challenge the provider and the dietitian that's caring for your child to give you that kind of reasoning on why they pick that. And that's why I mentioned earlier that every choice that I propose, or, to a family, I'm very thoughtful in that decision. And it's not just like, I think about the previous children's feeding history. Is there known food allergies, or they didn't tolerate milk protein? I'm going to think about that when I'm making choices. Or do they receive WIC services, and should I consider that into my, proposed nutrition plan? So I think there's so much that there is to think about. And I know as parents in that situation, it's not your forefront. You just want your child to survive.
Right.
And so I try to be respectful of that. And, but it's okay to ask the whys on why we're doing things and the way that we are. So, because certainly care is always changing, and we can always improve what we're doing. So,
yeah. Well, it's nice to know that I feel like environment is really opening up to parents asking a lot of questions and thinking about these things a little more than we used to. And I think that, like you said, I think the main goal is certainly, will my child make it out of here? You know, after surgery, it's very stressful, but at the same time, you know, the feeding is a lifelong situation, as is CHD in general. So
Yeah.
so I'm going to ask you kind of a fun question, is what has been the most rewarding experience so far in your career?
Oh yeah. So just seeing, I think one of the biggest things is seeing nutrition help kids thrive and the impact that it really does have. And I think about this example all the time because, recently, actually during COVID, this really came to fruition to me is, I had a patient who was 8 years old and came in with severe dilated cardiomyopathy, in addition to severe Crohn's disease that was untreated, which the inflammation essentially led her to this cardiomyopathy picture. And so she was at risk for almost every nutrition complication, as well as cardiac arrest, and ended up going through a lot of those risks and outcomes. But the fact that we were able to nutritionally rehab her, because it was a very thoughtful decision each single day. And we essentially nutritionally rehabbed her, which helped her cardiac status, and she was able to leave the hospital. I feel like nutrition in a sense saved her life. Obviously she needed the cardiac support as well, but the focus on that patient was improving her malnutrition. And so I feel like that's one of the things that's been most rewarding, especially as a pediatric dietitian. You really do see the results of your interventions. And, the other thing that I am involved in very heavily at my hospital, we started out as a quality improvement collaborative, and now we're going to create a clinic devoted to just weaning kids off their feeding tubes, because we know feeding tubes are like the double-edged sword, they're critical in certain moments of these children's lives, just to get them the nutrition and the energy and the endurance to help them overcome and what they've just went through. But at the same sense, anytime you put a tube in, you should have a thought on how you're going to remove it, or at least have a plan or criteria on how you're going to remove it. And so a physician and I have really, we noticed, and we know that we had a lot of kids going home with these feeding tubes, and these parents have expressed feeling left alone and no guidance after they left the hospital. And this is, I think, nationally and internationally, probably across the board, these feelings, because, patients travel all over to different hospitals and maybe not followed at the same hospital they had their surgery and whatnot. And so we created this quality improvement class. I mean, that's all it was. It was a quality improvement project. And just to see if we could wean kids off their feeding tube aggressively, and offer the support for that, versus the parent paying $5,000 out of pocket to have someone from, Germany do it or whatnot. And so we knew that was a cry out from our parents, and to kind of develop a program like this. And so that has also been extremely rewarding, at least especially in the last 2 years for me, just to see that these kids are able to be weanable, if you will, off their feeding tubes. They don't need to be dependent on them. Everyone has a chance and opportunity to eat. And so, when I weaned my child off the feeding tube, I did not know what I was doing, and I just cold turkey to an extent, and because she puked every time I fed her. I had to change literally buy carpet, and it was a horrible experience. And it took a lot of work and therapy to overcome just sitting at the table, seeing food and not having a gag reflex. And so, it's been very rewarding for me to just see how these kiddos are thriving, and we can grow and develop them normally, as normally as possible along their curve. So that has been a huge reward for me.
I will tell you, I cannot be more excited about that either. Having had a child go home on an NG tube and almost losing my mind. And I think I
Yes.
shared with you the first night I woke up in the middle of the night and the pump malfunctioned, something with the pump, and I was screaming for a nurse and I didn't realize I was home. It was terrifying. And I would have loved to have done that aggressive wean off the feeding
I know,
tube.
I would have too. The first night, my redhead, of course, being redhead, she's got to keep me on my toes, pulled her tube out and I put it in her lungs. So, like,
Yep.
I feel like even, we're all human, but it is hard as parents to ask us, to feed by a tube when we didn't plan on that. And so
Yeah.
to really provide a little bit more structure and support to parents. And I think centers across the world are getting on board with this type of program. I mean, the NPCQIC, we have a whole team dedicated on providing a tube weaning program for centers. We're in the process of piloting it actually with 2 centers. So there is a ton of work being done and a ton of other dietitians that are really devoted to this patient population to really improve the care. So certainly that's something you could check out if you have a kid that's tube dependent on, and challenge your center on like how can we get this tube out,
Yeah.
or at least improve some oral skills in that manner. So
Yeah, I think that's phenomenal. And I'm like I said, I'm so excited about that. And I think we greatly underestimate the size of the baby's finger, getting that between the tegaderm and the
yes.
tube as well.
We've learned some impressive taping techniques from parents. And we've passed them along. It's quite impressive.
Yeah.
So
Yeah.
we're all learning in that manner.
Yeah, absolutely. Well, I'm going to ask you one more question. And while I'm doing that, I just want to encourage people to type into the Q&A box. I know we had someone send some questions ahead of time as well that we have, and I'll pull those up in a second. But I would like to encourage you, if you have a question, to type it in the Q&A box and we will get to that. But my last question for you is, so organizations like Mending Little Hearts, and we have a lot of locations around the nation, how can we best support what you're doing, and how can we work with you effectively?
Yeah, I think doing these educational, webinars like we're even doing today, and having parents and these advocacy groups sit on our, hospital patient advocate boards, and we do a lot. I know, like, I'm sure other centers do that, like patient family heart day or education day, and incorporating that advocacy and education into that, I think is huge. Just, you guys are avenues for empowering parents on what to ask, especially new parents that are just starting at the process, out their journey with CHD, having questions on what to ask with their prenatal visits, having questions, what to ask after, what to expect with this type of lesion and surgery. So I think you guys are doing a great job with that, as far as educating and keeping, talking to us providers on what our thought process is, and understanding both sides of the journey, if you will, or both sides of the teams. We really try to incorporate parents in the decision making, and you guys, us as parents, we should feel incorporated. And I know sometimes, I have been on that other side where I've not felt included in the plan, or at least updated or communicated with appropriately. And I think sometimes as dietitians, I laugh about it, but I feel like sometimes I'm like a liaison or a counselor in a sense, because a lot of parents will vent to me about the situation, or we'll have an open, trustworthy conversation about what is happening. And even if it's a hard conversation, sometimes I'm there a lot just to listen. And I think that's key. I think as providers, sometimes we forget to just listen and let the parents share their concerns and their thoughts. And so I think continuing to be present and as many opportunities or experiences around improving the care. I know we have the support groups, join into a lot of the different networks, like the Cardiac United Network, which has all 5 networks now. There's networks for everything, and they're all collaborating, and it's so great to see. The heart failure people are talking to just the cardiac surgeons that are just doing regular lesions, or the adult care. And so everybody is trying. It seems like there's a concentrated effort to really work together to improve the care across the board. And that's so great to see from my standpoint. So
yeah, it is. It's nice to see how many parent patient organizations are now sitting at the table with everyone, like we're part of the team, and that is just a wonderful experience because we have a lot of knowledge about the firsthand.
Right. And and it's more than just fundraising and building research, money for research. It's about that's one reason I wanted to be on this Congenital Heart Alliance board, is like they're funding more than just like the research for the fellows. They're creating these funding and supporting networks for Fontans, and like my opportunity to ask for support with prenatal, like just an idea that we had about improving prenatal care with these moms of CHD. And so there's some really cool opportunities, I think, that parents can ask about within their own centers about how they can be more involved. Other things too, like we have a Heart Institute golf camp. That's something that I've been a pleasure to be a part of, and my daughter actually plays golf now because of a golf camp in 8th grade that we participated in to just give other opportunities for CHD who maybe can't be as active in those contact sports, so I think there's lots of opportunities, and it's really cool for me to see, because I certainly didn't have this as a new mom, kind of just learning by myself essentially. And when I started at Children's, there was only one other cardiac dietitian, and now we have 5. So we've built the program, and I'm very proud of that. And just having those resources, there's, and not all centers have all the resources, the same resources everywhere. And so I think, that's certainly, we don't want that to be unnoticed, but that's more reason to kind of bring it up to leadership of the Heart Institutes and kind of challenge them. So
yeah, which I think the parents are really good at.
Yes, we are. Yes. Yeah, I agree. Yeah.
Yeah, for sure. So the question, we had a few questions in advance, and one of them that I'm going to try to state a little more broadly because it was a little too specific for us, is I think there's a lot of confusion about nutrition that goes into the NG and G tube. Can you talk a little bit about that?
Yeah, so certainly, like when you're choosing or looking for the best type of nutrition for your child via a feeding tube, whether it's NG or G tube, there are actually a lot of options. And there's been a lot of improvement in the different formulas that are available today. Certainly something that I promote is more of a whole foods or real food blend, if you will, and especially for kiddos that are greater than 1 year of age, and trying to incorporate that again, because if you're not, we know, even though you're not taking it by mouth, there is certainly a lot of positive things that can happen with just getting that real food via the belly or the gut, intestines, however your child is fed. It can improve with digestion and motility. It can ultimately improve with tolerance, because we know our kids are spitters. So sometimes even having a little bit of a thicker type feed or milk, if you will, can improve just along the tolerance. If kids are puking and fussy and just intolerant, then there's never going to be progress with the oral feeding, or just in general with trying to put weight on them, et cetera. So there's a lot of options actually out there to promote more wholesome type diets, even if you're too dependent.
So that along with that, the same kind of thought, another question came in about the fortifiers and extra calories. Like a lot of times we're told that our child needs extra calories. And yet I remember when I added like cream to Joshua's stuff, he'd throw up. Like, that was not good for his gut. It was, it's calories. So can you talk a little bit to that, fortifiers for like in the hospital with the milks, and then the things that we can do, like where we can find information on adding calories without adding too much stress on our child?
Yeah, so different types of fortifiers. Like I know a lot of, historical, like I was told to add just butter to everything, or add butter to the purees. And certainly, a lot of our kiddos that we tend to probably recommend more higher fat sources because they're very concentrated in calories, and you don't need a large volume of that to get the biggest bang for your buck in a sense. But so, there's other ways to certainly fortify feeds and be creative with that. Like as far as in the hospital, though, sometimes depends on, what is available to use at your hospital. But I've done things as far as using hind milk only for high calorie breast milk if we've had an instance where we didn't tolerate fortification of breast milk, to using a more elemental type formula, or very just short term. Again, reevaluating the goals and the reasons why you're recommending that fortifier, and really understanding that from the parent perspective, I think is important. Sometimes, oils might be recommended just to sometimes prevent essential fatty acid deficiency if you have a chylothorax complication, which I deal with a lot, as well as experienced as a mom. So sometimes they're, understanding really those reasons, and then having conversations if you feel like the fortifiers aren't working. A lot of times those higher fat don't necessarily have like a negative impact down the road if you're using those calories, if you're consuming those calories. But making sure that you're promoting a balanced diet around that situation, I guess, is kind of the key. I've had a lot of parents that ask me, like, should I restrict fat or just do low fat? And like, no, you should healthy fats, heart healthy oils, use, canola oil, flaxseed oil when you're cooking. Those can increase calories and give the healthy fats that we want. Incorporating avocados into, anytime you can do seeds or nuts into that mixture. I mean, those are, don't be afraid of eggs because they have cholesterol, but they're really good sources of protein. And so there should be certainly always have those conversations with your dietitian, and try to, again, understand the reasoning why that is being recommended. But certainly there's lots of ways to do it, and very individualized nutrition options out there. So.
Well, thank you so much. This has been fascinating, and I learned a lot of new things. And so I really appreciate it. I'll let Andrea close us out, but thank you again, Megan. This is wonderful.
You're very welcome. I'm happy to be here, and it's been a pleasure as well.
Yes, I just want to echo Jody's statements and say thank you. We've learned a lot, and it's been wonderful. If anyone has any follow-up questions, you can feel free to send them to us, and we can share them with Megan and get some answers for you. All of the links that she mentioned will be posted as well on our website under the video of the recording. So with that, thank you again, Megan, and you all have a wonderful day. Bye.
Bye, everyone. Thank you.